Hi, I'm Angela. Welcome to our show. How stem cell therapy can help us live longer and look better. Joining us is Dr. Tiryaki, founder of the London Regenerative Institute, a pioneer in regenerative medicine.
I'm an associate professor for plastic surgery. I have two clinics, one clinic in Istanbul and another clinic in London. So I'm working in two countries separately. Of my plastic surgery work, we have opened a longevity institute, London Regenerative Institute at Corinthia Hotel, with my peers, kind of like most influential regenerative surgeons of the world. So we created a group of scientists who were building the building blocks of London Regenerative Institute, and we started bringing all these different clinics under the same umbrella to give longevity treatments in these different clinics. So London Regenerative Institute is a center where we assess patients' biological age and check their internal cellular functions and try to improve them. So we are taking the patients from internal as well as from external perspective. We can very easily do facelifts and stem cell treatments to make them look younger. That's kind of like the easier part. But we can also improve their cellular metabolisms to make them really healthier from inside. So that's kind of like the sweet spot between external longevity and internal longevity, and probably London Regenerative Institute with the satellites is the right place to be from that perspective.
Wow, very interesting. So can you tell me what brought you to this field? What inspired you?
Well, it's family business, to be honest. My father was a professor of molecular biology. He was probably one of the first people in Turkey who started talking about longevity many decades ago, and I was grown up through this basically. Then I became a doctor, and when I was a plastic surgery resident, we started working on cellular metabolisms, and I was lucky enough back in 2003 to bring plastic surgery questions and problems into his labs and into his lab force. So somehow it was a very interesting synergy between my father's team and our clinical and surgical work, and that's where we started creating cellular treatments to reverse the external aging in his labs, and then we took it to like a cellular center in Istanbul, and then finally now we are in London.
Wow, it's an interesting journey. So what is the biggest achievement or milestone you think you have through the
My
journey?
biggest achievement.
Yeah.
Well, I mean, there are few milestones. Obviously, starting cellular treatments in plastic surgery was a milestone because as surgeons we are trained to do big things, like we cut and we sort out the problems, etc. And that was not in our tradition to use technology. In the last 15 to 20 years, what we learned was we are able to utilize our body's own regenerative power. So that is, I think, unique for us. We were one of very few first groups in the world who started taking patients' fat, isolating the stem cells of them, and then using them for their own good, maybe for wound healing, maybe for burns, for facial aging, whatsoever. So bringing cellular treatments into plastic surgery, I would say we are one of the very few first pioneers.
Wow. You must be proud of yourself and your team, right?
I'm usually not proud of myself. I'm very much proud of my
Very
team.
humble.
I'm
Yeah.
very privileged to work with amazing people. May it be from the scientific perspective, our chief science officer is an amazing lady, Harvard trained in Turkey. Our management team is amazing. Our marketing team, they are the best of their kind.
Oh yeah.
I'm very privileged to work with amazing people.
I think you're both lucky. You're lucky to have them. They're lucky to have you, right?
Yeah, well, I'm probably lucky something what you create as well, right?
Yeah. Agree. So you have an amazing TED Talk, right? Like,
I don't know. I did my best.
You did my best. Your best. So, tell me. I mean, people really enjoy your TED Talk, right? Can you tell me about your talk and your...
Yeah, I think it is well taken because of, first of all, because of the name. You know, like if there is something interesting about vampires and science, you know, you're like, okay, what this guy is going to say. But then when you go into the story, it is actually a short history of regenerative medicine, how it was utilized in human history, like Cleopatra using some, you know, like spoiled milk baths, then to Knights of Templars seeking for immortality, then vampires drinking young blood very cleverly to stay young, and then we learning actually the truth behind all these like myths, I would say. So all human myths carry some truth, and in science we are now digging the truth and the data out of it. So that's sort of like the myth part and the science together is quite unique.
Yeah. It really brings hope to people, right?
That's our job. That's the job of medical personnel. I mean, we are supposed to bring hope, and we are supposed to care.
Of course. Yeah. We need someone like you in this field.
Well, I mean, I believe all around the world, all the doctors are working with the same same drive.
Different way, but same drive, right? Yeah. So, through your journey, what do you think the challenges you have overcome?
My major challenge is, you know, you are even in a very hostile terrain. If you know the terrain, if you know what to do, it's easy. You feel comfortable, you feel calm. In the field of unknown, it is hard. So in my case, you know, after the learning curve of surgery, I mean, thanks God it is our known field. Whereas when we started bringing all this information to business side, like to LRI, opening a different clinic in a different world, or creating firms and companies to produce these medical devices, these like cord blood creams. It is business, and we are not trained as business people. So that is my hardest challenge, I would say. To be in a doctor in the business world is hard.
It's amazing you handle both roles very well. I don't know how you made it.
I'm not sure I'm handling.
How do you keep your life balanced with different roles? Like,
well, I mean, I'm happy to have. I'm privileged again to have a family which is like letting me the time and space to do these things. So thanks to my wife and my son. Then again, I have a good team who are helping each other in this. And then it's hard work. I mean, yeah, as a team leader, you have to work hardest so that you can ask the people to work hard as well.
You must have a very good leadership demonstration to people, so people like to follow you and have the same mission.
That's something what we have to ask to my people. Hopefully I am.
And also you are lucky, you have a very good family, right? You have a very good support system, right? That's very important.
Yeah. I am. I'm very, very lucky from that perspective.
Yeah. So what is your vision in the next 5 years? What would you like to see?
Well, in plastic surgery, we are more focused on stem cell facelift. So we are bringing technology, space technology into surgery. So it's a very nice mix, giving very natural results in very short time with very low downtime. But that's kind of like that will evolve more in a way. That's the surgical part. In 5 years' time, from the London Regenerative Institute perspective, we expect this institute to be one of the leading longevity centers in the world. Because because where we are based, we are based in London. There's a huge history and know-how here. We are privileged to have all these like different plastic surgeons and dermatologists and scientists in the team. So that will pay off. And in terms of business side, like Morphia, our cream, for example, is first of its kind, literally concentrated umbilical cord blood, which is a base material, but utilizing the nature's most powerful weapon to ourselves. Basically, we have jarred youthfulness or youth information. So that will hopefully be one of the groundbreaking products at Amazon.
Wow, that's very ambitious. One of the best products.
Yeah, I can't say that I'm not.